It's been 8 months of masks, of lockdowns and curfews, of living in fear of COVID-19. And around the world, people are saying they've had enough. Coronavirus fatigue is setting in. Not just from the virus itself, but the restrictions governments have implemented to slow its spread. People are gathering closer together, wearing face masks less often. Some of the reactions have been angry. Demonstrations against coronavirus restrictions have drawn tens of thousands of protesters into the streets.
8 months into the pandemic, we understand that people are tired and yearn to get on with their lives.
With a vaccine likely still months away, people's desire to return to normality and the growing backlash against restrictions is becoming a major risk. After months of the pandemic, it's probably no surprise that many of us are feeling sick of getting sick. In Belgium, people are returning to school and work after the summer break. The number of new daily cases there is falling, but the country has one of Europe's highest death rates. Nevertheless, a study in Dutch-speaking region Flanders, home to more than half the population, shows 70% of people no longer support the restrictive measures aimed at slowing the spread of the virus. Our reporter Teri Schulz sent this report from Brussels.
The COVID-19 infection rate is declining in Belgium, but COVID-19 fatigue is growing. So many months of isolation, so many masks.
For me, it's like something really oppressive.
Thibaut, who doesn't want to give his last name, despises social distancing and defies the rule to wear a mask in downtown Brussels.
If I enter in a shop, if I go in the metro, okay. But if I walk alone in the street, no, that is really too much.
And Thibaut is hardly alone in his opposition. Michael Verstraetenus, who represents the protest group Virus Madness, says no one should have to follow restrictions except the most vulnerable.
How many people would die if we would not take any measures at all at the moment? We don't know, in fact. We have no idea.
New research shows just 1 in 3 people surveyed in the Dutch-speaking part of Belgium still supports the safety measures. That's down from more than 80% in March when the pandemic first hit here. University of Ghent professor Maarten van Steenkiste, who led the study, blames poor official communication for the dramatic drop in motivation. He says it's been a wake-up call for authorities to pay more attention to people's state of mind.
I don't think we have sufficiently been informing people on the consequences of their behavior for them to take a wise decision.
And now that summer's over, everyone's back from holidays, more likely to be in enclosed places at work and school. It could be a toxic coronavirus cocktail.
We're quite worried.
Leading Belgian virologist Steven van Gucht says experts are stealing for a potential September surge. He nonetheless agrees people should be given more information about actions and consequences, and then more autonomy.
So people can have some freedom to choose what they think is appropriate for their situation, and they can adapt their behavior.
But are people so sick of restrictions by now they won't follow them? Van Gucht believes most do comply. I don't obey them too strictly because it's very difficult, but I try anyway.
I feel much safer wearing it. We must do it all together.
But skepticism is clearly growing. In recent days, open letters have been published in Belgian media, signed by hundreds of experts, including doctors, scientists, and researchers, suggesting the strict measures should be reviewed to see if they're stopping the virus or just the vitality of everyday life.
Masks always. Well, let's speak to Naomi Rogers, who is Professor in the History of Medicine at Yale. Should we be surprised that people are starting to feel tired of the masks and the restrictions?
No, I really think we shouldn't be. I think that as someone who's also living through this as well, and as a historian of disease, I see all around me a sense that people have responded pretty seriously on the basis that this was some kind of disaster. So for a disaster, you hunker down, you follow guidance, and somehow there was an implicit bargain that it would end. Many parents, for example, worked extraordinarily hard with their children, restricting their movements, teaching them online, assuming that come the autumn, that all the schools would be open and everything would go back to normal. And it's been a real shock when that is simply not so.
Yes, like you say, there's this bargain, wasn't there? If we did as we were told, then we would get an early end to this pandemic, and it's not turned out that way for people. You mentioned you're a historian of diseases. Is there a historic precedence for this fatigue, people getting tired of trying to protect themselves?
Oh, actually, during the 1918 pandemic, and we don't know as much about the experience of people during pandemics as we really should, but it's very clear that people were so anxious to actually to be able to celebrate the return of World War I veterans. And finally, at the end of what we now know was the first wave of the pandemic, there were parades in the street, everybody was delighted, and there was also a feeling that the pandemic had ended. But in fact, that wasn't true. And then there was a real sense of anger and frustration when influenza reemerged as a major worldwide problem a second time in just a couple of months after that. So we do know that there have been historical precedents, both of the idea of waves and also the experience of living through them.
Yeah, people are impatient because they want this to come to an end. But what does an end look like? How can we say when, look, this pandemic is over?
That's such an interesting question. And I have to say that in my experience, I've written about epidemics and I've read widely about others. Historians just didn't seem to really problematize that question. It seems to me it's actually quite a complicated idea. What is an end? Who is it who's calling it an end? When does it feel like an end? And in particular, for example, living here in the United States, I noticed that during the summer, there's been a lot of call for the end simply to be the end, that everybody should be able to go back to restaurants and bars, go swimming in lakes and the sea, just return to an ordinary, happy summer time.
Essentially, they just want to say, this is the end. That's where we are now. Let's just pretend.
That's exactly. They're calling it the end. And this has been, as you can imagine, resulted in great frustration by many public health experts who say, well, but it isn't the end. And people in essence are saying, we have been relatively compliant. We have listened to the science, and you don't know when the end is. And I think that there is, I don't know whether it's so much a question of communication. I think that's probably one issue. But I think there's also a wider sense among the general public and really many public health experts as well, which is that they don't know. They don't really have a good sense of what the end is going to look like or how to more confidently predict it. And when your experts when you realize the experts don't know, that becomes an even greater motivation for just saying, well, maybe I can decide.
That's it, isn't it? That's the problem. Nobody knows. Well, at least this interview is now at an end. Thank you, Naomi Rogers from the Yale School of Medicine. It's been great to get your insights.
You're very welcome. Thank you for having me.
Now, have you got questions you'd like to ask us about the coronavirus? Well, get in contact on our YouTube channel, and our science correspondent, Derek Williams, will do his best.
What country has lost the most healthcare workers?
This question came in a while ago, and I wanted to answer it then, but I couldn't find reliable data. Now we have some. A new report released by Amnesty International last week revealed how the pandemic has taken a very heavy toll on frontline medical staff all over the world in the last 8 months. In all, it said that at least 7,000 healthcare workers have been killed by COVID-19 worldwide since the pandemic began. And we know that hundreds of thousands more have been infected with the disease while making efforts to contain it and to treat patients. The report said that over half of all confirmed deaths among medical staff had occurred in just 4 countries, Mexico, the United States, Brazil, and India. That's not really a surprise. Those 4 countries also represent more than half of all confirmed cases of COVID-19 worldwide. So to answer your question, Mexico is the country that so far seems to have lost the most healthcare workers to the pandemic. And it's lost them at a much higher rate in proportion to its number of confirmed cases than in other countries. One analysis said healthcare workers there were 4 times more likely to die of the disease than their counterparts in the US.